Good morning. Good morning. It's not fair. It is not fair that I have to follow Dr. Wareham. It's not fair. I mean, AJ, after all of the years we've been struggling to get this event out here, she puts me behind a landmark and says, follow that. Well, it's a good thing that I had enough foresight to kind of say, you know what? I'm going to tailor what I talk about just in case I encounter anyone out there who knows a little bit more than I do. So the first thing I want you all to do is I want you to look at your name badge. Look at your name badges, and there is a number on your name badge. Now, JP talked about memory. I want you to look at that number and memorize that single-digit number. Now I want you to close your eyes. Close your eyes. Now, for those of you who are a little bit challenged with your balance, you can open them slightly. I want everyone with the number 2 and 4 to stand up right now. All right, open your eyes. Take a look around. Some of you are standing with your family. Some of you are standing without your family. Some of you are standing with your friends, and some of you are without them. This is the impact of sudden cardiac death in the United States. Have a seat. 1 out of every 2 individuals out there suffers with sudden cardiac death. Now, as I mentioned to you, following behind the greats of Dr. Wareham and others, and he mentioned there's different types of docs out there, so I hope I'm in the good kind of doc. I'm not sure. But nevertheless, there's different type of docs. And so what we know is I decided I'm not going to talk about heart disease because that's easy. After all, that's what I do. I'm not going to talk about heart disease. That's what Chef AJ wanted me to do, but I said, no, I'm not. I decided I'm not going to talk about heart disease because you probably know it. I'm not going to tell you that the number 1 presenting symptom for heart disease is sudden death. Say I'm not going to do that. I decided that I'm not going to tell you that 1 in 3 women die from heart disease compared to 1 in 31 who die from breast cancer. I'm not going to tell you that today. I'm not going to tell you the fact that 1 out of 2 women of African descent have coronary artery disease by the time they are 20 years of age. I'm not going to tell you the power of 1. I'm not going to tell you the fact that since 1984, more women have died of heart disease than men. I'm not going to tell you that. I'm not going to tell you the fact that by the time I'm done speaking here, that nearly 30 individuals will have died from heart disease. That's 1 every minute. I'm not going to tell you that 1 person every 34 seconds suffers with a heart attack. I'm not going to tell you. Never underestimate the power of 1. The power of 1. Now, Pastor John, when we were coordinating this, he said to me, okay, Columbus, how will you know if this event is successful? I paused for a second. He said, I want to do some sort of survey. And it hit me. If we change just 1, if we change just 1 mother, 1 sister, 1 father, 1 son, if we impact just 1 individual's life, then that means this event was successful. And that's what we're here for. That's why I'm here. That's why Chef AJ is here. That's why Chef Babette is here. That's why they've driven all this great distance to impact the life of 1. Now, here's the interesting thing. A couple of people came up to me. And one young lady, I believe it was Miss Lee from Fresno, and her father was from Indian Wells. And she told me about the efforts he's putting forth in order to make changes in his lifestyle. And she said, thank you for having this event. I was speaking with another volunteer, and he mentioned, I know this young lady, Miss McKenzie. And he told me about how she's revolutionized her nutrition and how now someone asked a question, Dr. Wareham, about can my arthritis improve? Can my back straighten up? She no longer suffers with the arthritis the way that she did since changing her nutrition. Her cancer has improved and gone in remission through the efforts of lifestyle change. That's why we are here today. to impact the life of one. We're all in search of wellness, all of us. We all want to be well. None of us wants to be sick. We hate being sick, right? We're on that journey. We're on that journey towards wellness. And what studies have shown us, it shows us the fact that our social and cultural interactions impact our progress towards wellness. And my goal here today is that as we look at wellness, when we replace the I in illness with we create wellness. That's what we're here for today. What we want to do is we want to support the culture of change here in the Inland Empire as we progress towards improving our nutrition. But I'm not going to talk to you about wellness. I'm not going to talk to you about wellness. I want to speak to you today about the natural-born enemy of wellness. What do you think that is? Stress. Stress. How many of you guys have been stressed before? I was going to say for a while, okay, all right, you guys are just like me. That's good. That's good. Stress. Yesterday was my sweet 16th wedding anniversary. Wait a minute. You guys didn't hear me. Yesterday was my sweet 16th wedding anniversary. Now, most of you think I had a nice romantic dinner laid out for my wife, roses, chairs all set up. No, I was here till about 11 o'clock last night as she was at home with the kids putting them to bed. Right? Stress. There's no stress, right? There's no stress. She was happy about that, wasn't she? Yeah, that's right. No, she's been extremely supportive of me. Now, go ahead and stand up. Stand up. There's my wife. Oh, there she is. Oh, I see her. All right. I have to get out the doghouse any way I can about right now. Okay, so what we know is that when we look at things with stress, I remember distinctly the fact that she has been very supportive over the past several years. That's why I can be here today, day after my 16th year wedding anniversary. And what she has done, and what she told me, and I learned, is the fact that married couples who are in happy marital bliss do better. This past April, or March actually, there was a study that was released from American College of Cardiology. They looked at 3.5 million individuals. And what they found was that those who were happily married had healthy hearts, less stroke, heart attacks, ruptured aortas, compared to those who had strife in their marriage and were bitterly divorced. So thank you for the gift of a happy heart. What we know, though, separate from that, is that our life hasn't always been nice and pleasant and stress-free. We recently returned from our 20th year college reunion, and going on the campus brought back a floodgate of memories. What I recalled was the fact the first time I ever met her. And I remember seeing her before that time, and I said, ooh, I have to meet this young lady. And I used to practice in my head what I was going to say when I finally got to meet her. And so walking up to her, all of a sudden, my eyes dilated. My senses got acute. It was dark, but I could see her clear as day about a mile away. As I started walking closer and closer, my heart started pounding like if I had been sprinting 100 yards. My breath started increasing. I started breathing in deep. All of a sudden, I had that sensation in the gut of my stomach. It felt like a roller coaster, just a dip that was there. And then all of a sudden, my hands were uncharacteristically sweaty and clammy too as well. So I got to her and I said, okay, I'm ready. I've been practicing this. And I said, hi, hello, how are you? How you doing? What's your name? Needless to say, I did not get a first date. Stress, an external reaction to an internal stimuli. The body's response to an external stimulus. See, what happens when you get stressed, your eyes perceive it. Now it hits your frontal cortex, that brain right there, and then it doesn't just stop there. It works with this control center called the amygdala, which associates your emotions. So you recall immediately that barking dog. You remember that time you spoke up in front of a large group of people and you just stunk up the place. You make that association. Now your body goes into action. It activates the hypothalamus, which turns the key for that engine. And now there's one of two things. Either you're stepping on the gas the sympathetic system, or you're stepping on the brake, the parasympathetic. It's important. When that sympathetic system gets going on, like I described to you, that stress response, your eyes, your senses improve. The breathing increases. The blood shunts away from the skin and from the intestines, and now it goes to the muscles so they can get engaged and get active. The blood sugar increases in your system to feed the body so it can be able to get into action. This can result in great feats of excellence, or it can result as far as in life-saving ventures. Stress. Whether or not it's a beautiful woman, whether or not it's an awkward situation, stress. But when stress goes unchecked, what happens? All of a sudden, bad outcomes occur. Your mood changes. Depression can hit. Heart attacks can hit. Blood pressure rises. Cancers increase. The reproductive system goes down. All of these things happen when you're chronically impacted by stress. Diabetes, high blood pressure, high cholesterol, all have been associated with increased cortisol. So when we look at stress, common causes of stress. We all say we've been stressed out there. Most common, top money winner, money. Top money winner is money, right? Work, relationships, economy, your family, all these things play a significant role is what science and people tell us, right? Let me introduce you to Mary. Mary's a patient of mine, 56 years of age, a top executive. She's fought through every glass ceiling to achieve success. Unfortunately, during the economic downturn, her company was bought out. When her company was bought out, all of a sudden she had new bosses, new owners. Now Mary had to go ahead and toe the line. Her work demands increased. That meant that it put stress on her relationship. That meant that now she was unable to prepare her own food, so she increased eating out. She said, well, it's not too bad. I'll eat out. Her sleep went down the drain. She got increasingly irritable. She was unable to maintain her level of activity. At this point in time now, Mary got into a heated argument with her boss. Before she knew it, Mary was fired when she presented to the hospital. She presented to the hospital not with chest pain, but she came in saying, I'm tired. She came in talking about the fact that she was nauseated and her back was bothering her. So I examined her, and Mary's exam seemed normal to me. So I took a look at her EKG. This is what we do inside the medicine, for those of you who are not there. And we took a look, and curiously so, there are some minor abnormalities here in what's called the chest leads there. And so I said, well, that's weird. So we got blood work on Mary. I said, well, what's going on? That blood work came back that she had suffered a heart attack. No risk factors. Young, vibrant. We rushed her off to an angiogram on her. So I don't expect you guys, otherwise you put me out of business to know all of this, but her arteries looked normal. But what she had was a broken heart. She had what's called a stress-induced cardiomyopathy. Another name for that is called Takotsubo disorder. What all of that stuff means? Her stress led to her having a heart attack. Her stress alone led to her having a heart attack. So how does that happen? Well, your stress increases. You get a brief little fear, perhaps a death in the family, perhaps your loved one, right? Perhaps a loss of a job or your dog. And now all of a sudden it rises, the adrenaline increases, and now the heart has to work harder, and it collapses. That's there, and it no longer can function well. Stress, an internal response to an external stimulus. I want to present to you a different hypothesis today. I don't think stress is because of money. I don't think it's because of finances. I don't think it's because of family. I think stress is actually caused by poor nutrition. I think stress is caused by inactivity. I think stress is caused by lack of good sleep. That's what we're going to talk about today. Poor nutrition. Poor nutrition is simply foods, unhealthy foods that trigger a stressful response in the body, is what we look at when we talk about poor nutrition. It's more than just eating unhealthy. It's also not eating good foods that are loaded with phytonutrients, that are loaded with vitamins and minerals and things that can supply the body. 1950, Charles Mortimer was the head of General Foods. How many of you guys know what General Foods is? All right, so at least the company that has the Honey Nut Cheerio guy, a B on there, right? So General Foods was bought out by Philip Morris, the tobacco industry, right? And what we found with this is that Charles Mortimer back, he is given the term father of convenience. He coined the term convenience. He said, I want food that is easy to eat, easy to store, and easy to buy. He set out a directive to his people. He said, listen, go forward. I want you to build this cereal business. They were going head to head with Kellogg's. And with Kellogg's, they were fighting to see who's going to gain control of the breakfast table, right? And they couldn't quite do it. So one day he called for an all-hands-on meeting. Everyone was there. And he said, listen, if you cannot win the breakfast with cereal, win it with something else. Look beyond breakfast cereals. He said, after all, my daughter loves to eat cake for breakfast. I like ice cream for breakfast too. Well, nowadays we have not only cake for breakfast, we have cookies, we have Pop-Tarts, we have donuts. Anyone hungry right now? I guess you better not raise your hand right now. In our current society, our sad standard American diet, we know that over 70%, as JP mentioned, when you combine that with meats, 90% of our nutrition is from processed foods. 70 to 90% of our intake is from processed foods. What this does, it triggers basically the hunger process in our system. From a fancy standpoint, all that happens is it centers your reward system. So now all of a sudden, all the same centers that are triggered by cocaine and that are triggered by heroin are triggered by what we eat from processed foods. Now this spikes our insulin, which drops down immediately, and then we end up getting hungry and we eat more. A vicious cycle of what occurs here. You say, okay, what's the big deal? State of California, there's 4.1 times as many fast food and convenience stores compared to grocery stores, supermarkets, and produce vendors. 4.1. Now that ranges. Anyone have an idea which county has the lowest ratio? Santa Cruz, 1.7. Guess where we're at out here in the Inland Empire? 5.7 times as many fast food and convenience stores compared to groceries, right? Studies have shown that when you put grocery stores in convenient places to individuals, their rate of increase of fruits and vegetables goes as high as 32%. You know what that means? We live in a food desert. We have poor access to foods that can sustain us. Impactful. As AJ mentioned, and JP mentioned as well, we know that 70 to 80% of our intake of salt is from processed foods. I commonly will tell patients, listen, we gotta get rid of the sodium. I don't add any salt to my food. You're right, you don't have to. I told this one group, I said, processed, when I was growing up, my mother always told me, she said, chew your food 20 times. Chew your food. I'm chewing my food 20 times before I swallow, is what she told me. Nowadays, you don't have to. Why don't you? It's processed. It's chewed for you, right? You put it in your mouth and it melts. You ever notice that? It's interesting. That's there. What we found is by reducing about your salt intake by at least a half a teaspoon, you can reduce heart attacks by about 92,000. You can reduce strokes by about 59,000. You can reduce deaths by about 89,000 by reducing your salt intake. You think, okay, well, that's not a whole lot. 1 teaspoon is 2,000 milligrams of sodium. 1 teaspoon of salt is 2,000 milligrams of sodium. Impactful that we don't consider what we're putting into our bodies. As we've gone, what we know is that as the eating habits have changed, our obesity rates have risen as our processed foods have risen up. We know that as our sugar consumption has risen, so has our obesity, has our diabetes, has everything else, coronary artery disease and hypertension. As our natural food consumption has declined, so have these others inversely increased. It's significant. We have to look at what we're doing and get outside of our habits. Now, I have some who said to me, they said, well, a little bit's not bad. A little bit's not bad, right? Well, what we know by things like our fast food, they have things like advanced glycated end products. These things alone, separate from the proportion, can stimulate oxidative stress in the body and lead to insulin resistance. You say, well, I'm just going to have the small junior Whopper instead of the supersized Whopper, right? It should be okay. You're impacting your body with every decision that you make at every point. Sugar, recent study from January, added sugar increases cardiovascular events, increases your risk of death. I already told you that 1 out of 2 people who present how?
Sudden death.
1 out of 2 people present how?
Dead.
Death. When does heart disease begin? When does heart disease begin?
At birth.
Just close, almost just about there, right? From your toddler years, about the age of 2, in your first decade of life. Before the age of 10, heart disease begins. So if it begins then, and your first presentation is not chest discomfort, your first presentation is not that of shortness of breath, your first presentation is likely to be sudden death, doesn't it make sense that you kind of start preventing it now? I think so. When we look at things like meat, red meats and processed meats have been long associated with cancers, and there's a huge debate. You'll see lots of things inside the news about, it's not about the saturated fat. Don't worry about that. I present to you one issue here. What studies have shown, not just red meat, animal products, dairy products, that it stimulates a process in the system that's triggered through bacteria in the gut that can lead to the atherosclerotic process. That means your eggs, that means your dairy, that means your chicken, that means your fish. These things increase the risks that are there. It increases it. Now, whether or not we choose to partake and understand that or not, that's up to us, but the goal is you want to impact and do everything maximally as possible. Stress due to inactivity. JP put you through a whole bunch of exercises. I want everyone to stand up who exercised at least 3 times this week. Okay. I want you to remain standing if you exercised 5 times this past week. I want you to remain standing if you exercise 7 times this past week. All right. 6, I hear 6. Okay, all right, let's keep it going. How many of you exercised more than 10 times this past week? All right, sir, we have a winner here. That's what I call dedication, inactivity. What we know real quick is we know that too much exercise, it's not about exercise, it's about activity, as JP said. Too much exercise dates all the way back historically, right? To the marathon. What happened in the marathon? He was running from Marathon to Athens, and all of a sudden he said, "We won!" And he died. Too much. Too much, right? I'm not asking for that. But what we know is we want you to get active. Inactivity breeds stress in the body. Studies have shown, laboratory studies have shown, that when they've studied mice and rats, which they use a lot because there's a similar process as far as in humans, they found that there was increased risk of dysfunction of the vessels of the body. They also showed that there was increased resistance or propensity towards diabetes. So they said, well, let's look inside of healthy subjects. Let's look at men and women. They looked at healthy volunteers, and they found what? The same thing, that there was an increased risk of abdominal fat, right, over the organs. There was an increased risk of diabetes or insulin resistance. There was an increased risk in the lack of reactivity of the vessels, all of which were significant, similar structure and process to what happens during regular stress as we think of it. Physical inactivity, increased size here, that leads to a process that leads to cancers, diabetes, heart disease, depression, dementia, all of which are significant. We have to wake up. We have to wake up, and now we're going to go to sleep a little bit more. How many of you are sleeping well? I love that. How many of you sleep more than 4 hours on average every night? Wow. How many of you sleep more than 6 hours every night? That's wonderful. More than 8? Wow. That right there is good. Studies have shown that you need basically around 7 to 9 hours of sleep. But our society is different. What do we say? We say, choose two. My niece just got back from college. College life is so demanding, but it's a replica of what happens inside of our own society. Either you're going to get good sleep, good grades, or social life. It's never going to be the issue of choosing sleep, right? If you choose sleep, you're not going to get the others. If you choose the others, you're not going to get sleep. It does not have to be that way. There is an increased risk of death, heart attacks, stroke, increase in mortality 4 times the amount when there is lack of sleep in the body. This leads, as I mentioned, to a world of different issues that continually occur, from dementia, mood disturbances as well, heart attacks, hypertension, the same process. As there's a theme here. Lack of nutrition, lack of activity, lack of stress all cause the same process in our bodies, which is important. Decrease in leptin, increased ghrelin. That messes up with your attempt at weight loss. So you can do all the plant-based you want here, and you do not get your rest. Your body doesn't recover. Your body doesn't have a chance to assimilate what you've learned, doesn't have an opportunity at all to do any of those things. So it becomes important that you engage in daily sleep that allows you to decrease your cortisol, decrease the sympathetic activity, increase your activity. Don't go through this life fatigued. Do not go through this life fatigued. Don't go through. Pull over and stop and regroup what you do. It's important. So now what? Keep calm and change the game. Keep calm and change the game. Last story before I end, and we can get ready for lunch. Anyone hungry? Yeah. Me too. I met John. I've changed the names, so in that way I don't engage in, for those of you in the medical field, HIPAA violations, right? So I met John about 2007. John was a nice guy. He came in, he was 6 feet, 3 inches, about 350 pounds, and he kind of stumbled into my office. He told me about his symptoms of chest discomfort. He told me about the shortness of breath that he had. I was actually pretty concerned about him, and to the point I wanted to get him admitted to the hospital. But he said no. I got him set up for an angiogram, the invasive heart cath. And so we took him in, and we found there's basically the angiogram, there's 3 major vessels that supply the heart muscle. He had blockages 100% in 2 of the 3. The 3rd vessel had diffuse moderate blockage that was too small for us to do anything about, surgically nor through angioplasty stenting. So I unleashed the fury on him. We started medications, every medication you can think. And at that point, I wasn't in my area of enlightenment. I hadn't met AJ at this point. I told him, I said, listen, be moderate. Be good, 4 out of 7, right? You're not going to even love your wife 4 out of 7 days, right? You're not going to love anything 4 out of 7 out of 7, at least 4 out of 7 the majority of the time, and you work your way up to it. Well, between 2007 until 2011, John progressively worsened. He had more chest pain. He had more shortness of breath. His inactivity went in the tank. His sleep degraded continuously. And what we found towards the end, in 2011, he walked in my office. Now he was unable to walk from here to the microphone without having to stop because of chest pain and shortness of breath. He sat down as I typed and I spoke with him, and he told me what was going on. And I looked at John, and I said, what do you want to do? And he looked at me, kind of turned his head to the side. I said, what do you want to do? He said, well, that's why I'm coming to you. I said, you need to change the game. He looked at me a little bit more, head cocked a little bit more. I said, change the game. I said, what that means is that you need to change the game. You need to commit to changing your nutrition, not your diet, your nutrition, how you feed your body. You have to commit to it. I explained to him plant-based whole food. I didn't use terms, no offense to anyone, a vegetarian or vegan, right? I've been vegetarian my whole life, but I love Baskin-Robbins and I loved Dorito chips and all these things for a good portion of it, right? That doesn't mean you're healthy when you say you fall under a label of vegan or vegetarian. It's about what you're putting in your body. I went on to explain to him the importance of his activity, no matter where he could stop or start. I explained to him the importance of good rest, not just sleep, but rest. Resting away from the cell phone and the pager and the tablets and the computers and everything else. I explained to him about that. He didn't leave my office happy. He didn't leave my office looking at me with a smile on his face or saying, "Hey, thanks, Doc, I appreciate that." He walked out, and I thought for sure he was going to go right to my medical director and say, "What kind of quackery is this guy doing?" 1 month passed, I didn't see John. 3 months passed, I didn't see John. I didn't see John until 11 months later. This time I walked in and I saw John, and I said, "Hey, John, how you doing? Surprised to see you." And he said, "I'm doing great." I said, "Well, what's great?" Well, I listened to this one doctor. He went on to tell me what he did. He told me that he changed his nutrition. He told me that he changed the game and changed his nutrition. He told me that he changed the game and changed his activity. He told me that he changed the game and changed his degree of rest that he engaged in. He told me that he changed the game and it had, in turn, changed his life. Healthy Taste, I'm talking to you today. What are you going to do? Change the game and change your life. Change the game and change the life of your family. Change the game and change the life of your friends before it's too late. Don't wait until it's too late. 1 out of 2 first presenting symptom of heart disease is sudden death. There is no second chance. Change the game today, right? It's not mutually exclusive. We like to live in a world and say it's mutually exclusive. Either I go on the side of Western medicine and medications or I go on the side of lifestyle modification. They are not there. What happens is, as you move towards lifestyle modification, you need less of Western medicine. If you go back from lifestyle modification, you're going to need more medication. It's simple. It's like a seesaw. Change the game and change your health. Healthy Taste.